Thank you, Mr. Chairman, and thank you to the panel for this very informative discussion. It was mentioned that there are clusters of dengue in Florida and Texas. It got me thinking, just in terms of folks coming across our southern border. There's been a lot of discussion about different diseases and other public health concerns. Dr. Frieden, is this also a concern that folks coming across the border could be bringing Zika with them? Is that something we're looking at?
Well, on the one hand, we know that Zika and other diseases do spread largely because of human migration. But in fact, there are 40 million Americans or 40 million people from the U.S. who travel to Zika-affected areas each year and then travel back. And so the number on the border crossing will be a very minute proportion of that. What we have seen is in some communities that are essentially across the border, for example, Brownsville and Matamoros in Texas, when dengue spread, it spread in both parts, but it spread 8 times more in Matamoros because it was more crowded and had less access to air conditioning.
I understand. Dr. Lurie, what role will mosquito or vector control play in our response to Zika?
Well, as we talk about this paradigm of, prevent, detect, respond, prevention is key. So mosquito vector control's got to underpin our efforts for the foreseeable future, for Zika and also for other vector-borne diseases.
Well, there are currently 700 mosquito control districts across the United States at the state and local level. What role should the federal government play in mosquito control?
One of the areas that we would like to enhance and for which we need supplemental funding is to better understand the capacity of mosquito control districts and to support improvement of that capacity and better linkage of the mosquito control districts with the health departments and environmental partners, whatever's most effective within that state or county. They often bridge multiple counties and they may not always be well integrated, but in effective vector control programs for vector-borne disease, you may need an integration of the public health staff and the mosquito control staff to identify the places or even the houses to target, and that's really important and one of the areas that we want to urgently improve.
And when you talk about houses targeted, are you talking about spraying insecticide? Is
Yes.
that the effective way to
both
stop?
Insecticide and what's called larvicide that kills the developing mosquito.
Okay. Well, because this mosquito that carries Zika breeds in small pools of water, often indoors near houses, aggressive trash cleanup and removal is something that's been talked about as one of the most effective ways. Do you envision a federal role in terms of trash cleanup and those sort of things, or is it more the information?
No, I mean, we really want to support state and local entities with technical guidance. We also recognize that reduction in breeding sites, cleanups, is important. It's high profile, but it's very difficult, as you point out, with mosquitoes that can breed in the amount of water of a bottle cap. It can be extremely difficult to be effective. So it is a component of integrated vector control strategies. We do think that is a state and local responsibility, but we have, I believe, a responsibility to provide technical guidance, best practices, and catalytic funding to try to improve that, especially when something as unanticipated and potentially devastating as Zika is upon us.
And so the funding request doesn't cover any of those type activities. It's more just the coordination and information.
We would have some support for local vector control, mostly along the lines of rapidly surging in if there's an area that's not able to do it and for a particular cluster by establishing rapid response teams, sharing best practices, identifying resources that can be shared among jurisdictions. At CDC, more than 60% of our funding or thereabouts goes out to state and local entities. We exist to support the front lines at the state and local government, but what we do at CDC is to develop the tools, the science, the things like the test kits for Zika that we then distribute to and support local entities to use.
Makes sense. Is it possible to predict or anticipate using surveillance or other means what the next emerging infectious disease would be?
There are many people who would tell you yes. My own belief is probably not, because there are so many possibilities. Just to give you a sense, I just returned from a trip to Africa looking at some of our programs there. I've recently spoken with our teams in India. They've identified 2 tick-borne viral hemorrhagic fevers. This is Congo-Crimean hemorrhagic fever and Kyasanur forest disease that are much more widely distributed than anyone knew before. So whether we're going to have now a tick that could bite you and you could have a bleeding disease that kills you, I don't know if that's going to come next. But no one, I think, would have predicted that the H1N1 would have come from Mexico, or MERS from the Middle East, or Ebola widely distributed in West Africa, or Zika causing birth defects.
Thank you. Mr. Chairman, I'm out of time. Yield back.